G'day, my name is Mike Chao and I'm a radiation oncologist from the University of Melbourne, the Olivia Newton-John Cancer Centre and Genesis Care, Victoria. I have the pleasure of discussing our paper published in the BJUI titled Prospective Analysis of Hydrogel Spacer for Prostate Cancer Patients Undergoing Radiotherapy. The clinical problem we face is the close proximity of the rectum to the prostate, making rectal radiation currently unavoidable. This could lead to significant rectal complications such as proctitis with bleeding, frequency, urgency, as well as mucus production, including ulceration and even fistula formation. The risk of rectal toxicity depends on the volume of rectum that receives a high dose of radiation, classically 70 Gray, which we refer to as the RV70. This study reports on the use of hydrogel spacer called Space OAR in 76 patients with T1 to T3A prostate cancer undergoing intensity modulated radiation therapy. The primary objectives were hydrogel spacer safety, its dosimetric benefits, and the cumulative incidence of late gastrointestinal toxicity. All patients underwent general anesthesia prior to fiducial marker insertion and injection of hydrogel spacer prior to prostate intensity modulated radiation therapy. This was performed using a transperineal approach under transrectal ultrasound guidance. An 18-gauge needle was inserted in the midline under sagittal vision into the perirectal space immediately posterior to Denevelius fascia. This was followed by hydrodissection to ensure that the needle was within the perirectal space, followed by injection of 10 mL of hydrogel spacer, which temporarily displaces the rectum away from the prostate for approximately 3 months. We reported no postoperative complications. The median prostate to rectum separation at the base, midgland and apex were 11, 8 and 5 mm. No difference was observed in patients with prostate volumes under or above 100 cc's. The median volume of rectum receiving 70 Gray, or the RV70, was 7.8% compared to our historical non-hydrogel spacer cohort of 12.5% using advanced intensity modulated radiation therapy, representing a relative reduction of almost 40%. Even more significant percentage relative reductions were achieved at higher radiation doses of 75 and 78 Gray. At a median follow-up of 14 months, the cumulative incidence of late grade 1 gastrointestinal toxicity was 2.8%, comparable to the pivotal randomized Space OAR study of 2%. No grade 2 or higher gastrointestinal toxicities were observed in both studies. So in conclusion, hydrogel spacer is well tolerated. An increased perirectal space which reduces rectal radiation. It reduces the severity of radiation toxicity, and it can still improve on advanced radiation techniques such as intensity modulated radiation therapy. A little space does indeed make a big difference.